Good afternoon and welcome to today's webinar, Consumer Education 101. This is the first in a three-part series, and we're so glad to have you here with us. My name is Sarah Diamond, and I'm going to be presenting our speakers for this afternoon. And before I do that, I want to share a little bit of some housekeeping items for you. So first of all, we want to give a special shout out to our members. Here at Child Care Aware of America, our mission is to advance a child care system that effectively serves children and families, and that work is strengthened by a national network of child care resource and referral agencies, along with other diverse members and partners. We are honored to support our members in becoming trusted resources in their communities. So again, we welcome you. We invite those who would like to learn more about our membership to reach out to us, and we'll be sharing some contact information at the end of the webinar and would love to hear from you. Before I introduce our speakers, just a few notes for you. First of all, your lines are muted during the presentation, but we hope that you will participate through answering poll questions, sharing any questions that you have in your question box, or using the chat feature. And you should find these in your GoToWebinar or GoToMeeting control panel. So there should be one place for questions and another small chat box as well. We're going to be monitoring those questions and the chat throughout the presentation. So do reach out if there's anything we can do to answer your questions or provide you with support. Also, please do note that this webinar is being recorded. The webinar will be made available on our YouTube channel, and we plan on following up with those who have registered for this webinar with an email. That will include a link to some special information. You'll receive a copy of the presentation, as well as an invitation to join a follow-up discussion that will be taking place. So our speakers are going to share a little bit more about how you can be involved in that special opportunity at the conclusion of the presentation. So let me introduce to you our speakers today. We are really honored to have Jessica Reed, who has been with Child Care Aware of America since 2010. She assists families with child care consumer education and military fee assistance programs. She also develops content, provides training, and oversees website updates and maintenance. Previously, she worked as a caseworker for family child care providers who were participating in the Child and Adult Care Food Program in Rochester, New York. And she's also provided the 15-hour licensing training for prospective family care providers. So those of you that are joining us from family child care, she certainly will be very familiar with your work. She also has a degree in Spanish and secondary education from Houghton College. So we're really grateful to have her on with us. And joining her is Victoria Ballou, who has been with Child Care Aware of America since 2009. And Victoria oversees the National Child Care Consumer Education and Referral Hotline and website. She also plays an integral role in the DoD and Military Child Care Fee Assistance Program. And previously, she had worked with children from special needs in a child care setting. So again, great expertise here. Victoria's degree is from Virginia Polytech Institute and State University, and she has, that's in psychology, and she has a Master of Education in Applied Behavior Analysis from Arizona State. So we are really excited to have you here, and we're very happy to turn things over. And we are going to start by hearing a little bit more from Victoria.
Thank you for that introduction. We are excited to have the opportunity to engage with you today on this topic that is near and dear to our hearts. Now that you know a little bit about us, let's do a quick poll to find out what role you play in the child care field. Please take the next 20 seconds to select the option that best fits your current role. Thank you. Let's take a quick look at the results. So based on the results, it looks like the majority of us attending this webinar today are child care resource and referral specialists, as well as we have some child care resource and referral directors and supervisors, and a few others as well. Sarah, did you want to share a few of the others that might have been typed in the chat box?
Yes, absolutely. So we also had folks in the position of family child care coordinator and education consultant and child care resource and referral, I believe it is case manager. Yes, so child care resource and referral case manager.
Great, thank you so much. Now that we have an idea of who's joining us today, we wanted to take a quick look at the CCR&R landscape based on a survey that we recently conducted as part of our Ignite project. One staff member from every single CCR&R was invited to participate in the survey, and we just wanted to share a couple of the highlights with you. So CCR&Rs exist in 47 states and DC. 39 states have state CCR&R networks, and 23 of those state CCR&R networks have administer a statewide consumer education hotline. The green box highlights some of the services CCR&Rs provide. 96% of those surveyed shared that they help families find childcare, which is why it is essential that the referral specialists have a solid understanding on childcare consumer education. We have a variety of important roles here today, and I think each one of you will take something away from the presentation. The main goal of this webinar is to review the basics of childcare consumer education. If you are new to the CCR&R field, we hope that you will leave us with a good foundation on how to engage with families who are searching for quality childcare. If you are a CCR&R veteran, we hope this will be a good review and might inspire you to think of new ways to deliver the information and services that you provide to families in your area.
Before we jump into the content, we'd like to take some time to think a little bit about consumer education and how it's different from consumer engagement. And once again, we'd love your help with this. So using the chat box, please share what comes to mind when you think of consumer education. And this could be specific topics related to consumer ed or a description of what you think it is, or even just general concepts. And as those come in, we'll have Sarah share some of your thoughts with us.
Great, so we do have some responses rolling in. So they range from folks who are thinking about best practices to information on available programs, providing information or access to information to a consumer. Someone has indicated that they think of family engagement. We have providing parents on things to look at to find quality childcare. Others think about types of childcare, indicators of quality care, community resources and needs, or regulatory information. We have a lot of people who are adding things like how to find quality childcare or helping to educate the community about early care and education, as well as some indicating things like child development and information around that. So quite a wide variety of responses that are coming in, but many of them seem to be kind of around that area of sharing information with families on quality care, community resources, or being able to build families' knowledge of what quality looks like.
Wonderful. Thanks for sharing, Sarah. And thanks everyone for sharing so far. We actually have a second question for you. It's similar. But now we'd love to hear what comes to mind when you think of consumer engagement. So again, this could be what you think of a general description for consumer engagement, or even the ways that you think it's different from consumer education. And as those come in, Sarah will share some of your contributions with us again.
All right, so we have, in terms of what folks think of related to consumer engagement, we have location and availability of care, meaningful conversation, needs assessment, words like trust and connection, consumer feedback, parents' ability to be involved in care, connecting consumer to services with a focus on back and forth conversation. Some really nice responses.
Wonderful. Thanks again, everyone, for sharing. We appreciate your participation. And it looks like we're on the same page. We're thinking about consumer education as referring to providing information to parents to help build their knowledge and understanding. While when we are talking about consumer engagement, as many of you said, we mean going beyond just sharing information to truly find ways to have a two-way interaction that engages the family in the entire process from start to finish. Today, our discussion will focus on the topics and concepts that we want families to take away from their initial interaction with the CCR&R when they're starting their child care search. We won't be spending much time on how to truly engage families for a deeper understanding of those topics, but we will spend a whole webinar on consumer engagement in the future. Today's topics will include consumer education that lays the foundation for child care referrals, so what parents would need to know in order to understand a referral list, licensing versus quality, or the difference between a license-only child care program and one that is committed to raising the quality of their care, the importance of evaluating a child care provider and how to do this, and tools for the road so that families can continue the evaluation and selection process on their own. There are two categories of foundational knowledge that families should know in order to understand a basic list of child care referrals. The first is an understanding of not only the types of child care available in their area, but also information on what types may best fit their individual needs. And the second key category is state-specific licensing information. It's important for families to know the basics of what it means to be licensed in their state.
We'll start by talking about the types of childcare. Our main responsibility in sharing this information is to help parents understand what is available to them so they can make an informed decision. At the most basic level, we should be helping them learn about the types of care in their area so they know what they'll be choosing from. And we can then go above and beyond by using our professional expertise to share specifics about which types of childcare might be the best fit for their needs. It is important to keep in mind that it is never our job to convince a parent to use or consider a certain type of care, but it is our responsibility to present the variety of options in a way that highlights the potential benefits to the family based on their needs. Of course, this means that it will be essential to listen carefully to the needs and preferences the parents share during the conversation. The next few slides will briefly touch on the different types of care that may be available and reasons why they may be a better fit for some families than other options. Family child care home programs usually provide care in the caregiver's own home. They may be licensed. They usually have smaller groups of children, often of mixed ages, and usually they only have one or two caregivers present. Families choose family child care providers for different reasons, but some may prefer a family child care home for the following reasons. The home-like environment is appealing to many families. Family child care providers care for fewer children at one time. This may be important for preemies or other children with weakened immune systems. Siblings can be together because most family child care homes have different ages of children enrolled in the same group. There are fewer adults that may care for your child on a daily basis, which can lead to stronger relationships between the caregiver, child, and family. Family child care homes are more likely to offer non-standard hours of care compared to other types, and some programs may even offer lower rates than the average child care center. In child care centers, care is provided in a non-residential setting. They usually have to be licensed. Children are often separated into groups by age, and typically there are at least 2 caregivers per group. They can be chains, nonprofits, or privately owned, and they're usually open during standard business hours. Families choose child care centers for different reasons, but families may prefer a center for the following reasons. Child care centers have a classroom-like environment where children are cared for in groups with other children, typically their same age. They have more adults present in the building and may be able to offer a wider variety of activities and opportunities. And also, child care centers often have more regulations and inspections for health and safety standards. Preschool programs usually refer to programs for children ages 3 to 5, but some providers often offer programs for children as young as 2 years old. These programs tend to be part-time and are designed to promote school readiness. The preschool may be a standalone program, or it may be nestled within other program types, such as a full-day childcare program. Families who are specifically looking for preschool programs may be looking for opportunities for school readiness and socialization, but they may still need full-time care. Some families may also have specific preschool philosophies that they're seeking, such as Montessori, Waldorf, or Reggio Emilia, or others. School-age childcare typically refers to care for children from kindergarten to 12 years old. Care for this age group is offered before and after school and also may include school breaks. Some before and after school programs are provided by elementary schools on site at the school, but they can also be through other community organizations such as the local Parks and Rec, YMCA, or Boys and Girls Club. Or they could even be a part of another child care program such as a center or a family child care home. They may need to be licensed, and some programs may be activity-based. Remember that you're the expert on childcare in your area, and you can share so much more than just the types of childcare. For instance, if you're speaking with a family that expresses concern that they're not eligible for fee assistance, do you happen to know of any providers that may offer lower rates, such as a nonprofit program or a religious organization? Or do you know if any local providers offer sliding fee scales or scholarships? I have just a few other examples to share with you of ways you can really use your expertise. So for instance, if you're speaking to a family who has a preschool age child that needs full day care, do you know of a full day preschool program? And if not, do you know of a program that offers wraparound care for before and after the part day preschool? For a family with a child who has special needs, can you think of any providers that you could refer them to that have the capability to care for their child? Or for a family whose first language is not English, does your organization keep track of what native languages are spoken at the child care provider? It is not only important to take this deeper dive into helping families find referrals, but also to remember to be realistic. For example, if you know finding overnight care in your area is going to be difficult, make sure you're clear and upfront with the parent to avoid giving them false hope. And be prepared to provide suggestions or next steps if there are no providers in the area that will meet their unique needs.
Once you've helped to narrow down the type or types of childcare that may best fit the family's needs, it's time to share a little bit about how childcare credentialing works so that they can make an informed choice. As you know, childcare licensing works to protect the health and safety of children in regulated childcare facilities. All states have childcare licensing regulations, but they vary by state. Each state determines which programs must be licensed, which areas of the program are regulated, and the specific regulations that have to be followed. Usually, licensing regulations cover standards like health and safety, safe sleep practices, caregiver to child ratios, group size, food preparation and serving, staff training requirements, emergency preparedness plans, and background checks for staff. So why is it important to talk about licensing? Many parents who are looking for childcare for the first time may assume that all childcare providers are regulated. We've often heard from parents just starting their search that they thought all childcare providers that are legally operating were regulated. Having a discussion on licensing informs parents that this is not always the case and makes them aware of which providers may be unregulated or license exempt. And this new understanding encourages them to verify the regulatory status of a provider. Additionally, even if a parent does not end up choosing a provider from the list you're giving them, they'll still have the tools and information to ensure that the provider they choose is regulated if that's important to them. While parents are the expert on their child and family needs, you are the expert on childcare in your area. So think about what you can share about licensing requirements in your state, such as which programs are required to be licensed, information on frequency of inspections and where inspection results can be found, knowledge on who needs to be background checked and what types of checks are required, review of training requirements, and explanations of any regulations on safe sleep for families of an infant. And you can, of course, add in anything else you think would be important to share. Think about the specific needs of the family you're working with and what might be most beneficial to share with them. For instance, if they have an infant, spending time on safe sleep regulations will be very important. Or if they've had a previous negative experience with unregulated care, then information on inspections, background checks, or training requirements for regulated providers may help to put their mind at ease. During the licensing conversation, you can also take time to explain licensing inspection reports. The majority of states currently have inspection reports online in some capacity. Some are very detailed, and some are more of an overview of when a program was inspected and whether or not violations were noted. You also might already incorporate inspection results or links in your online search engines. It's important as the child care expert to familiarize yourself with what's available and how to access it, so you can share this information with families. This is an easy way that families can get more information on the health and safety records of a child care provider before they even set up a tour. Every family should know that these reports are available to them, how to access them, and that includes even if your state doesn't yet share them available online, and how to read them. Many families we interact with don't realize they're available at all. So we already talked a little bit about how families assume child care providers are licensed and meet certain quality requirements. So when we explain licensing, we want to make sure that they don't make the same assumptions about all licensed providers. As the child care expert, you know that licensing does not guarantee quality. It's often just the first step to becoming a quality child care provider. Parents need information on how to select a program that goes above and beyond the minimum standards so that they can make an informed choice. And it's important that you provide them with the tools and resources that they can use to evaluate program quality.
So quality rating and improvement systems, often referred to as CCR&Rs, are one approach to evaluating program quality that may be available in your state. CCR&Rs is a systematic approach to assess, improve, and communicate the level of quality in child care programs. If your state or local area offers a CCR&Rs, it can be a useful tool to see which providers are going above and beyond basic licensing requirements. If you have a CCR&Rs in your state, you should be familiar with the basics of the system, such as knowing the name of the program, whether it is statewide, regional, or in the pilot phase, which symbol or rating system is used, and whether some or all providers are required to participate. CCR&Rs is one of the many tools that can help guide a parent's decision-making. The ratings provide quick and easy way for families to see the quality of a provider in a way they understand. They probably are already familiar with restaurant and hotel star ratings, so this is a comfortable area for them. Be prepared to share some details with them of where they can find the ratings, what standards CCR&Rs measures, what the low and high ratings mean, And what does it mean for a program to have no rating at all? If a program doesn't have a rating, does it mean they chose not to participate, that they're not eligible to participate, or maybe they don't meet the minimum standards to participate? If a family has just moved from another state, make sure they know that QRS programs in every state go by different names. It is a good idea to know basic information about the programs in states that surround your state, or at least to have quick access to our map that can give you the information on other states' QRS programs. We'll take a quick look at our map in just a bit. Some child care programs reach higher levels of quality by becoming accredited by a national accrediting body. Achieving accreditation is a voluntary process for child care providers. Programs that choose to become accredited have to show they meet certain requirements, many of which go above and beyond state licensing requirements. As you can see here, national accreditation allows child care programs to evaluate themselves and to be evaluated externally based on indicators that have been identified as predicting the overall quality of a program and or positive development outcomes for children by being in compliance with these key indicators. The accreditation process starts with an application and a self-study process, then typically requires parent and staff feedback, followed by making steps and changes towards quality improvement. There are several national accreditation bodies, but two of the most common include NACCE for child care centers and NAFCC for family child care homes. The national accreditation organizations have online search engines where families can check to see which child care programs in their area have earned a national accreditation. The links to the online search engines might be something you consider including in a follow-up email to the family, and it can also be helpful if your referral list indicates whether or not a provider is accredited, if your system tracks this information. Another way to evaluate quality is to find out what qualifications the program staff may have. In addition to a program-wide accreditation, individual staff may have specific early childhood credentials and training that they bring to the table. Staff education is one of the best predictors of quality in a child care setting. We know that adults with training in early childhood education provide higher quality programs for children, implement more appropriate activities, and do a better job of preparing children for school. You can encourage families to ask the director and the teachers whether they have a degree in early childhood education, child development, or a related field, or if they have additional credentials such as a CDA. This is a great place to customize your consumer education. For example, if the family you're working with mentioned they have a child who takes daily medication, they should make sure someone on staff has a certification in medication administration training, or MAT. And if a family has an infant, they want to be sure all caregivers in the infant room are trained on safe sleep practices.
All of the tools we previously discussed can and should be used to get an understanding of the potential quality level of a program. They can even help a family narrow down their list to only the programs they want to visit. But one of the best tools for evaluating quality is the in-person visit. A visit allows a parent to use their senses, their judgment, their instincts, and what they know about their child to determine if it might be a good fit for their family. We always want to be sure to strongly encourage an in-person visit to potential child care programs whenever possible, and we can do important work to equip families to make the most of every visit and to go in with a plan. You'll need to combine what you know about local child care with what you've learned about the needs of the family in order to equip them with what to look for and ask about on their child care visits. This slide shows some examples of key quality indicators that can be shared with families. Some of the top indicators that we always mention to families include a low adult-to-child ratio, small group sizes, and positive interactions. And we also encourage families to ask about providers' education and training, national accreditation, staff turnover rates, and measures taken to keep children healthy and safe. Keep in mind that you can discuss what's required in your state in terms of something like adult-to-child ratio, but you can also encourage families to look for programs that go above and beyond state standards for a higher quality of care. There are, of course, many indicators that you could discuss with a parent if they're interested, but in the end, your agency may decide which quality indicators to prioritize, and you also can use what you've learned about the family to share what you think is important for them to know. In addition to the actual quality indicators, parents should also know that it's wise to stay long enough to truly get a feel for the program and to be able to look for these indicators of quality. We usually recommend that they plan on a tour taking about an hour. And they should also know that it's their right to ask questions during their tour. We've often spoken to families who mentioned visiting providers who were reluctant to answer their questions or who maybe seemed irritated by specific questions that were asked. So for this reason, we always try to assure families that quality child care providers should welcome questions as an opportunity to display their commitment to quality. During your initial interaction with the family, you may just be getting them started on the road to finding a quality child care provider, but you also want to give them tools so that they can continue their research on their own. A follow-up packet or email should include some of these key tools and resources. So you can think about including information and website links to online inspection reports, QRIS ratings, national accreditation databases, checklists for an in-person child care visit, information on child care financial assistance, and any other child care or non-child care related resources a family may need, like SNAP, WIC, or Medicaid. You can use this follow-up as an opportunity to continue to engage with the family. So once again, we would like to hear from you. What tools and resources does your agency offer to assist families after their initial interaction with you? So again, we would ask if you're interested, you can share these things in the chat box. And what we're going to do is to compile this list of the resources that you share with the entire group through the Basecamp discussion board after the completion of this webinar. And if you have a specific resource that you'd like to share with the group, please feel free to include a link and we'll capture that and share that as well. We're not going to take the time now to read through the contributions out loud, but we hope you'll find a moment to look through them on the discussion board later. And we'll give you a few moments to think and to type in anything you'd like to share, although as we move on, please feel free to continue to share. Thanks to those of you who are sharing or considering sharing with us and with the group. We also have a few resources to share that we thought may be helpful to you and the families you serve. On our website, we've compiled checklists of questions for each type of childcare that we discussed earlier. Each checklist can be accessed as a web page or printed out in a PDF format for a family to take with them on their visit. And if downloaded, the PDF is also fillable from a phone or a tablet if desired. All of our web pages and resources are available in both English and Spanish. So to find these checklists in Spanish, you can either visit the English web page using the URL you see here and select Spanish at the top right-hand corner, or you can select Spanish from the home page and navigate from there. We'll show you briefly how to locate them from our English language homepage on the next slide. So if you prefer to start from the home page, you'll just visit www.childcareaware.org. And if you're on your computer, you'll look for the main menu and hover your mouse over Families, then over Choosing Quality Childcare, and then you'll click on Selecting a Child Care Program. And it will be the same options from a mobile device, but you just have to click on each one of those menu options. Once you're on the Selecting a Child Care Program page, you'll have options for each type of program's checklist. You can click on whichever checklist you'd like to view, and you'll find a blue button at the top to view or download the PDF version of the checklist. Or if you'd just like to view the checklist as a web page, below we have the drop-down sections for each topic that's included in the checklist. We also wanted to give you a brief view of our state-by-state resource map that we mentioned earlier. You can find this map using the URL at the top here, or you can always find it under the Resources tab on our main menu. Once you've located the map, you can click on any state to have access to over 25 state-specific resources under 5 different categories, from child care resources to health and social services to financial assistance programs offered statewide. These resources were compiled based on the requests we received over the years from families who were needing help not only finding child care, but also with additional resources for their families and children. And the last resource we wanted to share is our nationwide CCR&R search. You can find the CCR&R search option visible on our homepage just under the main banners, but there's also a CCR&R search box on every page of our website, so it's always easily accessible. If a family calls in that's not within your service area, or maybe they tell you that they're about to move outside of your service area, you can use this search to find out which CCR&R will be able to assist them outside of your own. And we would recommend doing a zip code search whenever possible. And the results page for each agency's profile will look something like this.
All right, we want to wrap up our discussion today by looking at just how much your services truly do for families. A family may call in looking for a list of child care providers, but you are able to provide them with so much more. You assist them with every step along their child care journey. On the left-hand side, we've listed out the 4 steps to finding child care that we discuss on our website, and we paired it with your role on the right-hand side. You'll see that your role spans every step of the process, from getting a list all the way down to taking a tour. We'll pause here for just a moment to give you a chance to look over this slide before we move on. Remember, your consumer education truly matters. All of the bits and pieces of information, all of the tools that you provide, all the ways that you use your expertise to guide and engage a family in this process, these are things that help a family to build, or they help to build informed and engaged consumers. When families leave your service, ideally they'll know that it's important to evaluate their options before choosing one, as not all programs are equal. They'll be confident in both their instincts and their understanding of what quality childcare might look like, and they will be equipped with the tools to guide them through the process. They will know that their questions are important. All right, so that's everything we have for you today. We do have time now to answer some questions. So if you have anything you'd like to ask about today's presentation, please feel free to go ahead and type that into the chat box, and Sarah will read some of them off to us to answer.
While those questions are coming in, thank you all for sharing great ideas and resources that we'll be able to compile for everyone. That's really, really exciting to see, and we appreciate it. So there is a copy about whether or not the PowerPoint will be made available for others to use as a reference. So we are going to be including access to the PowerPoint. We will be sending out a follow-up email that will give you the information you need to be able to download a copy of the presentation. And it looks like that was a few people's questions. There also was a question about the checklist. So is it possible, this was submitted by Gretchen, is it possible to use or adapt the checklist that you've provided for her own website?
Yeah, I think that is something that we could definitely work with her on. we would have to probably make sure it's cited properly, but it could definitely be adapted.
Great. We have another question from Carly, who wants to know, how have people used the CCR&Rs rating system with parents without appearing as though they're recommending?
That's a great question. So really when we're speaking with parents, our goal is to educate them. So we are really not necessarily recommending they go with a certain rating. We're just informing them of what the ratings are and what they mean and where they can find them. And then we're really leaving it up to the parent to determine what is the best fit for their family.
And also highlighting the fact that it's one of many tools. So a high rating doesn't mean that it'll be a good fit for their family. So the visit is still a crucial piece. So trying to provide sort of the gamut of tools so that they know this right here shouldn't be your sole deciding factor. And hopefully that also comes across as this isn't our recommendation, because what is the right fit for one family isn't the right fit for everyone.
That's great. And there's a lot of compliments here for you, Victoria and Jess. A lot of folks are saying thank you for sharing and really appreciating the information. There also was a comment in reference to the response about QRS systems. And so someone had shared that, QRS is one of the tools to use. It isn't necessarily the only decision or consideration for a family to be able to make a choice, but it's just one of those tools to help inform that choice. All right, so I don't see any further questions at this time, but we want to be sure to give you all an opportunity to type those in, so we can give that another minute. Again, lots of thanks are coming in, so lots of appreciation for the information. And I know that we shared that a copy of the presentation will be shared with you. It is also okay for you to be able to use some of that information for your purposes as well. So I just wanted to make that clear. Someone had commented that they liked the simplified language and wanted to be able to use that. So we appreciate that feedback, and you will be able to use that information.
Thank you, Sarah. So for any questions that we haven't gotten to, you'll have the opportunity to post those on the Basecamp we'll talk about in a moment. And we will also look through the chat box and make sure we post any questions that went unanswered as well.
Or those that would be good discussion topics for the group.
That's excellent. So we also might be helpful if we go ahead and display some of our contact information as well. Not only are we going to be sending some follow-up information to you with some more information about how you can continue to be a part of the discussion and access to some of the resources, but we also invite you to stay connected with us. You are welcome to reach out to Child Care Aware of America using our Learn More at usa.childcareaware.org email address. We'd love to hear from you. We also have included some information that would link you to our CCR&R blog. So for those that haven't yet had the opportunity to visit the blog and be able to access some of the information there, please do bookmark that site. We'd love to have you. And then there is also a link to our membership page. And you are welcome to find more information about our membership using that link as well. We want to give very special thanks to our presenters for this afternoon. So thank you, Victoria and Jess. This has been very valuable information, very easy to understand, and we can tell from the comments that have been coming in throughout the presentation that the information is very much appreciated. So thank you for your time in putting this information together. And thanks to all of you who took the time to attend today. We're really grateful for your participation, your feedback, and we look forward to reaching out to you soon with a follow-up email. And we hope you'll be joining us for the second and the third webinars in this series. Have a wonderful afternoon, and thank you all so much for attending today.